Hello, my name is 𝗃𝗓𝗃𝗀𝗃. I'm a pediatric surgeon based in Kuala Lumpur, specializing in keyhole or laparoscopic, thoracoscopic, or minimally invasive surgery in children. A lot of my patients are children of doctors and surgeons who look out to bring their kids to me because of my specialized skills in keyhole or laparoscopic surgery. In this new series, I have created to dispel the common myth that people have about pediatric surgery in general or about laparoscopic or keyhole surgery so that things are clearer for parents. So stay tuned and take care.
Dr. Nada, pediatric surgeries are often the first treatment option for children's health issues. Is that true or false?
False. For most conditions, when I see patients in clinic, they don't need surgery. Almost 90% of kids who come to my clinic do not need surgery. Only about 10% of kids who have obvious problems will require surgery. The most common things such as hernias or problems with groin area. And those are the obvious structural abnormality which will need surgery. Vast majority of patients come in for functional problems such as constipation or with abdominal pain, which can be treated simply with medications.
Dr. Nada, anesthesia in surgery poses high risks and often leads to complications. Is this true or false?
False. Anesthesia in children is very safe. And this day and age, we have fantastic ways of monitoring the child throughout the anesthesia process, looking at the heart rate, the breathing, oxygen levels, the blood, and so on. And it's extremely safe, it's extremely well monitored, and rest assured that hundreds of children, even premature babies, have anesthesia without any long-term or short-term problems.
Infants and very young children feel less pain, so surgery is less traumatic and painful for them. Is that true or false?
False. Children, even babies, feel pain. The degree of pain is not measurable in babies because they can't express how painful things are. So even for something simple that is done in the bedside, such as circumcision, I think it's painful for a baby. And therefore, we need to make sure that they are as pain-free as possible when something like a minor procedure is done. In fact, for circumcision in babies, I strongly disagree to doing them at that age because there's more complication other than pain. There's also risk of complications in the penile area when circumcision is done in the newborn age.
Dr. Nada, children recover from surgeries much faster than adults. Is that true or false?
Generally, I find that the children recover faster. That's because their perception of pain is less and their anxiety is less, I think, because all they want to think about is to get on with their life, go back to playing and enjoying what they do. I think compared to adults who are more concerned, more anxious, and more rigid in their ways, they seem to perceive the whole process of surgery and pain much more intensely than children do. So as far as children are concerned, they go about their own business very quickly because they want to get on with life compared to adults.
Dr. Nada, all pediatric surgeons are trained to perform the same types of surgeries. Is that true or false?
That's not entirely correct. That's because most pediatric surgeons are trained to do the basic conditions equally. However, some are trained to do specific conditions in a specific manner more than the others. So, for example, laparoscopic or keyhole surgery, somebody needs to be trained in a specific center to do them and also practice what they've been taught. So do regular surgeries in the same manner so that the expertise are much more refined. So for example, for me, I have been doing keyhole surgery or laparoscopic surgery for last 20 years. And that is, for me, something that is second nature. So most of my procedures are done laparoscopic or keyhole surgery so that children will experience much faster recovery and less pain.